Hello, Internet. I know I'm way overdue with this update, and I apologize again. It seems like I do that a lot lately because I haven't been posting as often as I used to post for various reasons. But I wanted to bring you guys up to speed because there's been a lot of news in the last 10 days, 10 days or so. I did have my scans, actually not just scans, but like full blood work, appointments that covered just the gamut of the stuff that's been going on for months and months and months. Cardiology, oncology, urology, all of those things. I think I had 8 or 9 appointments on Thursday, and then I had the two biggies on Friday. That was my CT scan, abdomen, pelvis, chest, and also my meeting with my oncologist late in the afternoon, and then that was the end of it. So wanted to update you guys. I haven't been very good at communicating in these last 9 or 10 days, mainly because I've been trying to personally just absorb all the information and just sort of analyze it, process it on my own before I felt really good about spreading the news. Because basically the news is not great. My scans show that the cancer, after being quiet, it wasn't completely gone, but what was there was very small, relatively insignificant, and not growing or spreading aggressively for the last half a year or so, even more than that, I would say the last 8 months. But the scans on Friday showed that I have enlarging, they call it interval increase, in lesions, nodules, small tumors in my liver and also in my abdominal area, a couple just in the belly fat, so to speak, itself, and then a couple of others in the peritoneum. If you don't know what that is, that's the spongy area, basically your abdominal cavity that's in between all of the organs. And there's one small, these are small, I will emphasize, like 1 centimeter, 1.5 centimeters, but developing near the right diaphragm in the peritoneum or the peritoneal cavity, and then another one further down towards the pelvic area, or let's just call it the very lower part of the peritoneum. There's another one that was not there last time. Also, there's still a couple of enhancing and enlarging lymph nodes. I guess the good news from this is that the very, very small nodules that were in my left lung, have not grown much, if at all. But now, both in my right and left lung, they are very small. We're talking 2 millimeters, 3 millimeters. So these are really small, but still they're there, and they have increased slightly in number. So, it's not a huge surprise, but of course it's not great news. And, considering that I'm just, I guess, pushing 3 months beyond my open heart surgery, I've been feeling better and better. And, it just continues the trend of the last 1.5 years now, exactly 1.5 years since my diagnosis, where it's just one thing after another after another. So even though I tried to maintain a good attitude, a positive attitude, it's not just the physical, it's the mental and the emotional and the spiritual, just the whole ball of wax. We all know how everything influences everything else. But, with the summer coming on, I was looking forward to being in a healthy place. And the fact is, now my attention has to return to the cancer. What my cardiologist is suggesting is for us to get on some chemo, and that's going to be happening very quickly. It's going to be a combination of pills and an injection. It's only a 1-hour injection infusion that goes directly into my vein in my arm, because I don't have a port anymore and I don't have a PICC line. But it's about a 1-hour infusion of a cocktail of drugs, and I won't go into that now. I'll save that for a further video, because we're still trying to determine what that cocktail is going to look like. But what I do know, I already have a big bottle of pills that I will be taking starting on the 9th of May, so that's next Thursday. 4 pills in the morning, 3 in the evenings, and it's going to be 2 weeks on, 1 week off. So 3-week cycles, and we're going to start with 4 cycles. So that means 12 weeks. That'll take me into the end of July. And again, in concert with that will be the infusion, which is going to be every other week. And I will go down to Rochester, to Mayo Clinic for that. So basically that means that, well, I'll be getting started again on treatment. And of course, you never know what the side effects are going to be, what the implications as far as how I'm going to feel. The first time I was on chemo between November of 22 and March of 23, I managed to avoid the nausea and the vomiting, which I'm very grateful for. Also, I didn't lose a lot of hair. It kind of thinned out. The main things for me were fatigue, terrible fatigue, and like some skin issues, neuropathy, but also there was a period in March of 23 where my hands became so cracked and dry, and no matter how much moisturizer I put on my hands, it didn't help. And then also I had like little skin rashes on my chest and on my forehead and my scalp. So, and I also had a very watery diarrhea. And since I have a stoma bag, in a way that's good, because it means that the stoma bag takes care of collecting what's going on and you're not having to run to the bathroom every 10 minutes. But on the other hand, you have to empty a stoma bag. So anyway, that's just a little bit of a heads up. It's sort of unknown what my symptoms are going to be. Some of the drugs are similar, like Fluorosil, Folfox. We're not quite sure if there's going to be oxyplatin, panitumumab. Some of these I'm not pronouncing exactly right, because even after all these months, I still haven't gotten all the drug pronunciations down. The pill is called capecitabine, and those of you who have been through cancer, they actually, this cancer pill is also used for breast cancer, other kinds of gastrointestinal cancers, esophageal. So it's not only used for colorectal cancer metastasis, but for others, quite a few others as well, in various stages. So anyway, that's all the news I have right now. It's going to be very busy the next week. We're waiting on a DNA, a genetic test on my blood that will show exactly what this injection cocktail of chemo drugs needs to be like. So, later as I get more information, I will do my best to communicate that to you guys. But I wanted you to know where things are. It's back on the chemo train, and I'm very grateful that I had 14 months off of chemo. But my oncologist is not terribly surprised. I'm not terribly surprised. I was just hopeful and optimistic that maybe we had more time before we had to start doing this again. So your prayers are so precious to me, so valuable, so appreciated. The love that you guys send my way, I've already told you that so many times. This inner circle of people who follow these videos, it's not a lot of you, because I haven't really shared my information far and wide. I'm not a Facebook person. I don't like to, anyway, I won't go into all that right now, but I'm very happy with the, like I said, inner circle of people who are in the know, and it's not really that important to me to share beyond that. If it happens, fine. I'm not against it, but it's just I'm not motivated to you know, widen the social media circle myself. So there you go. I will leave it at that for now, and I will thank you very much for your thoughts and prayers and love. And yeah, we'll get back, and I will communicate more when I know more. So thank you guys.